Hello, I'm a physician with over 30 years of experience in bone health and osteoporosis research. Today, I want to talk to you about a topic that affects millions of people, especially as we age: osteoporosis and the medications commonly prescribed for it. You might have seen commercials promising stronger bones or heard friends talk about their prescriptions, but there's a lot of misinformation out there. And some common mistakes about these medications can lead to serious consequences. My goal is to pull back the curtain, share real stories from my patients, and offer practical advice to help you make informed decisions about your bone health. Stick with me. This could change the way you think about osteoporosis treatment. Let's start with a story that hit me hard early in my career. I had a patient, Mrs. Maya, a vibrant 72-year-old who loved her morning walks and gardening. One day, she tripped over a small step in her garden and fell. The impact shattered her femur. Her thigh bone literally broke into pieces, with fragments visible through her skin. She described the pain as unbearable, like her bones were grinding against each other. At the hospital, the orthopedic surgeon immediately recognized it as a fracture linked to long-term use of a certain osteoporosis medication. That moment stuck with me because it showed me how the treatments we trust can sometimes do more harm than good if we're not careful. This brings me to the first big mistake people make: assuming all osteoporosis medications automatically make bones stronger. You've probably seen ads claiming these drugs reduce bone loss and lower fracture risk. That's partially true, but it's not the whole story. Let me explain. Your bones are living tissues, constantly remodeling themselves. Two types of cells are at work: osteoclasts, which break down old bone, and osteoblasts, which build new bone. Many osteoporosis medications work by slowing down the osteoclasts, so less bone is broken down. Sounds great, right? But here's the catch. While this can make bones appear denser on a scan, it doesn't always mean they're stronger or more flexible. Take Mrs. Maya's case. Her x-rays showed thickened cortical bone, the hard outer layer of her femur. On a bone density scan, that might look like progress. But in the operating room, the surgeon found that her bone was brittle, like glass. Instead of bending under stress, it shattered. This is a known issue with some medications, especially when used for many years. The bone may look good on paper, but it lacks the resilience to handle real-life stresses, like a fall or a twist. I've seen this mistake play out too many times. Patients and even doctors misinterpret denser bones as healthier bones, when in fact, they can become dangerously brittle. Now, let's talk about the second mistake: believing medications are the only or best solution for osteoporosis. When I meet patients, many assume that a pill is their ticket to strong bones. I understand why. It's appealing to think there's a simple fix. But medications are just one piece of the puzzle, and relying on them alone can backfire. Let me share another story. Mr. Felix, a 78-year-old retired teacher, came to me after fracturing both wrists in a minor fall. He'd been taking an osteoporosis medication for years, yet his bones were still breaking. Why? Because medications don't address the whole picture of bone health. Your bones need more than just a drug to stay strong. They need proper nutrition. Think calcium, vitamin D, vitamin K2, and vitamin A from foods like yogurt, leafy greens, and salmon. They need movement, like walking or dancing, to stimulate new bone growth. And they need hormonal balance, as things like thyroid function can affect bone remodeling. Mr. Felix's medication slowed bone loss, but it didn't help his body build new, flexible bone. He wasn't eating enough nutrient-rich foods, and he'd stopped his daily walks after retiring. His fractures were a sign that his bones were brittle, not resilient. I worked with him to add more dairy and greens to his diet, start gentle walks, and check his vitamin D levels. A year later, he was stronger and hadn't had another fracture. The third mistake is not questioning long-term use of osteoporosis medications. Many patients start these drugs in their 60s or 70s and stay on them for a decade or more without reassessing. This can be risky. Let me tell you about Mrs. Amber, a 75-year-old who loved ballroom dancing. She'd been on an osteoporosis medication for 8 years when she slipped during a dance and fractured her ankle. At the hospital, we found her bones were dense but brittle, a hallmark of prolonged medication use. Her doctor had never discussed pausing or switching treatments, assuming the drug was still helping. But studies show that after several years, some medications can increase the risk of atypical fractures, like the one Mrs. Amber had. These fractures take months to heal, sometimes up to a year, and can derail your life. I'm not saying these medications are always bad. For some people, especially those at high risk of fractures, they can be life-saving in the short term. But staying on them indefinitely without a plan can lead to trouble. I always tell my patients, your treatment should evolve as your body does. Regular check-ins with your doctor, bone density scans, and discussions about whether to continue or adjust your medication are crucial. Mrs. Amber's fracture could have been prevented if her treatment had been reevaluated sooner. The fourth mistake is ignoring the side effects of medications. Every drug has risks, and osteoporosis medications are no exception. I've had patients experience jaw pain, digestive issues, or even rare but serious problems like atypical fractures or bone necrosis. Let's go back to Mrs. Maya, the patient with the shattered femur. After her fracture, she told me she'd been having thigh pain for months, but thought it was just aging. That pain was likely a warning sign of bone stress caused by her medication. If she'd reported it earlier, we might have caught the problem before her femur broke. This is why I urge patients to listen to their bodies. If you're on an osteoporosis medication and notice new aches, pains, or anything unusual, don't brush it off. Tell your doctor. It could be a signal that your treatment needs a second look. I've seen patients like Mr. Matthew, a 70-year-old who developed jaw discomfort after years on a medication. We caught it early, adjusted his treatment, and avoided a more serious issue. Being proactive can make all the difference. Finally, the fifth mistake is falling for the marketing hype. Commercials make osteoporosis medications sound like miracle cures, with images of active seniors hiking or dancing. They often gloss over the risks or oversimplify how the drugs work. I remember a patient, Mrs. Bhatya, who started a medication because an ad convinced her it would stop bone loss and keep her strong. She didn't realize the drug only slowed bone breakdown, not built new bone. When she fractured her knee after a minor trip, she was shocked. She felt betrayed by the promises she'd heard. My advice? Don't let ads be your doctor. Talk to a healthcare provider who can explain the pros and cons of any treatment. Ask questions like, how does this drug work? What are the risks? How long should I take it? Mrs. Bhatya's fracture taught her to be her own advocate, and she now asks detailed questions at every appointment. You should too. So what's the takeaway from all this? Osteoporosis medications can play a role in managing bone health, but they're not a one-size-fits-all solution. They don't guarantee stronger bones. They're not the only answer, and they come with risks that need careful monitoring. Instead of relying solely on drugs, focus on a holistic approach. Eat nutrient-rich foods, stay active with weight-bearing exercises, and work with your doctor to ensure your treatment plan fits your needs. Stories like Mrs. Maya's, Mr. Felix's, and Mrs. Amber's remind us that bone health is about building resilience, not just density. I've seen patients transform their lives by taking charge of their bone health. One of my favorites is Mrs. Jade, a 74-year-old who fractured her wrist after years on a medication. We shifted her focus to nutrition and exercise, and she started walking with her grandkids and eating more dairy and greens. 2 years later, her bone density improved, and she felt stronger than ever. Her story gives me hope, and I want the same for you. If you're on an osteoporosis medication or considering one, talk to your doctor. Ask about the risks, the benefits, and whether it's still the right choice for you. If you've made it this far, I know you're someone who truly cares about your health, especially the strength of your bones and joints. Thank you for watching this video. I hope the new tips and insights we've explored together will help you live a healthier, more vibrant life every day. But here's a quick heads up. On platforms like YouTube, you might come across ads from pharmaceutical companies promising miracle products. Remember, lasting bone and joint health doesn't happen overnight. Issues like joint pain or osteoporosis take time and consistency to improve. Instead of chasing quick fixes, trust in the power of a natural lifestyle. Eat wholesome foods, stay committed to exercises that support your body, and keep learning about how your body works. Which tip from this video did you find most helpful? Drop a comment below. I'd love to hear your thoughts. If you enjoyed this content, don't forget to hit like, subscribe, and ring the notification bell so you never miss our upcoming videos. Let's build a healthier future together, starting today. Disclaimer: the information provided in this video is for educational and informational purposes only. The information provided is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or watched on this channel. Reliance on any information provided by this channel is solely at your own risk.